Today we can discuss about infective endocarditis. For the diagnosis of infective endocarditis, there is a criteria called modified Duke's criteria. We can remember this criteria from the word endocarditis. We can take this D. Remember this word endocarditis when we study infective endocarditis. From this T we can remember Duke's criteria. So infective endocarditis, the criteria is Duke's criteria. Okay. Then there are two types of criteria, major and minor. In the major there is a 4 criteria. First one is blood culture positive for infective endocarditis. Evidence of endocardial involvement. This is suppose this is endocardium. There is any evidence of endocardial involvement. Then third one is echo positive for infective endocarditis. Last one is new valvular regurgitation. And let us discuss a detail about blood culture. The typical microorganism consistent with infective endocarditis from 2 separate blood culture. We should get positive result from 2 separate blood culture. The commonest organism are viridans streptococci, Streptococcus viridans, Streptococcus bovis, Hayes group, Staphylococcus aureus, or community acquired enterococci in the absence of primary focus. Microorganism consistent with the infective endocarditis from persistently positive blood culture defined as follows. At least 2 positive blood culture, blood sample drawn more than 12 hours apart. There should be a gap of 12 hours. All 3 or majority of more than 4 separate cultures of blood with first and last sample drawn at least 1 hour apart. There is an exception to this, the single positive blood culture for Coxiella burnetii or antiphase IgE antibody titer more than 1:800. Then evidence of endocardial involvement, all we know. Third one is echo positive for infective endocarditis. It is recommended in patient with a prosthetic valve rated at least possible infective endocarditis by clinical criteria or complicated infective endocarditis. Echo as first test in other patient defined as follows. Oscillating intracardiac mass on valve supporting structures in the path of regurgitant jets or an implanted material. Absence of alternative anatomical explanation. Abscess, no partial descent of prosthetic valve. Last one is no valvular regurgitation.